Right. Good afternoon, everyone. Thank you very much for joining us for the next webinar in the Institute for Health Policy Studies and Impact, uh, Policy Skills webinar series. Really delighted to have you with us today. Today's topic is understanding professional societies' roles in policy and advocacy. And just briefly about our series, this is a series of webinars that Dr. Beth Griffiths and I organize in our capacity as co-associate directors of the Institute for Health Policy Studies for policy programs. And this is really our contribution to improving the policy skills and knowledge of the IHPS community. And today we have four panelists with us, including Dr. Griffiths, who are going to talk to us about their experience with professional societies and the role of professional societies in policy and advocacy. And we think this is important because professional societies really do have a pretty substantial impact on health policy at local, state, and national levels. And they really are a way, an avenue for faculty, trainees, and staff to plug into health policy. And so we wanted to give you four, perspectives from faculty from different vantage points. So Dr. Griffiths, in addition to being co-associate director of policy programs at IHPS, is Director of Healthcare Advocacy for the Division of General Internal Medicine and provides primary care at UCSF. Dr. Kelly Lee is Professor of Clinical Pharmacy and Associate Dean for Assessment, Accreditation, and Residency Program Director for the Psychiatry Pharmacy Residency at the University of California, San Diego School of Pharmacy. Then Dr. Bethany Phoenix is a faculty member emeritus in the School of Nursing and has done a lot of work on regulatory frameworks for advanced practice nursing. And then last, Dr. Kathleen Tebb is a developmental and health research psychologist who is part of the Division of Adolescent Medicine in the Department of Pediatrics and has been very engaged in community-based participatory research and digital health research. That I'm going to stop talking now and I'm going to turn it over to our panelists, and I've asked them to each tell us a little bit more about their areas of expertise and how they've worked for professional societies to advance evidence-based health policy. So I wonder, Beth Griffiths, would you feel comfortable kicking us off?
Yeah, sure. Happy to. Thanks so much for having me on this panel. I'm really excited to be in dialogue with all of you. My work, as Janet said, I am a primary care doctor. I spend a fair amount of time doing that. And then I also spend a fair amount of time teaching trainees and also faculty in the space of policy advocacy and community engagement. In a variety of different settings. And then obviously with Janet and in another role with the impact program, also get to work with researchers on translating their findings to policy change. And my work with professional societies began when I was a medical student. I have been in a number of different roles, mostly with the California Medical Association. I have, when I was a trainee, was somewhat involved with the American Medical Association and was on their Council on Medical Education. And in their a member of their House of Delegates where they are deciding policy. I have been on the CMA Board of Trustees and I've also had a number of different roles on their Council on Legislation and at the local level at the San Francisco Marin Medical Society as well. Most of the different roles I've had have focused on policy and advocacy in one way or another. And as far as the issue areas, they have been broad, quite frankly, as often happens in professional societies, although I have spent some of my work focused on parity and reimbursement with the Medi-Cal program, workforce issues, and focus on particularly access to primary care and behavioral health, as well as how that's designed. And I'm happy to talk more about any of that. I have also been a little bit involved with the Society for General Internal Medicine, although I haven't had as many leadership roles there. So happy to share any of that experience.
All right, well, I'm going to pass the baton to Beth Phoenix, who also has been very active in the behavioral health space.
Hi. So just a correction, I'm not an emerita yet. I am going to be retiring this summer.
my-
So close, but no cigar.
Okay, well, my bad. We don't want to rush you out the door at all.
Yeah, yeah. So anyway, I'm clinical professor and vice chair in the Department of Community Health Systems and teach in the psychiatric nurse practitioner program. And my research and service has focused on the behavioral health workforce, specifically the role and impact of nurses in the behavioral health workforce, and how scope of practice regulation affects the ability of nurse practitioners to increase access to behavioral health services. So my primary involvement with professional associations has been with the American Psychiatric Nurses Association, which included chairing the Advanced Practice Council and a task force on psychiatric advanced practice credentialing, and membership on a recent workforce task force, as well as serving on the organization's board of directors for 5 years, including a year as president. I'm also a fellow of the American Academy of Nursing and a member of their mental health and substance use expert panel. And we have an article that identifies a policy agenda for behavioral health that's now in press. So some examples of the ways I've worked with APNA to advance evidence-based health policy include this advanced practice nursing credentialing task force that reviewed existing sources of evidence, such as comparisons of advanced practice nursing regulation across states and role delineation surveys to make recommendations about national psychiatric advanced practice nursing certification. And then this recent workforce task force was a survey of over 5,000 psychiatric mental health nurses and advanced practice psychiatric nurses that looked at demographics, educational preparation, practice settings. And findings from this survey informed recommendations for educational institutions, state regulators, and government agencies that monitor and influence the behavioral health workforce. And this report has been distributed to a variety of policymakers, including state boards of nursing, the National Council of State Boards of Nursing, and various federal agencies that are involved with behavioral health workforce.
So thank you very much, Beth. That's a great, rich set of details and examples of how you're working with your professional association. Kathleen, I'd like to go with you next.
Wonderful, thank you. So I've been with UCSF, just for context, since 2000, and much of my work involves developing, implementing, and evaluating interventions to promote adolescent and young adult health. I do a lot of community-based participatory research and translating evidence into programs and policies, with the primary focus on sexual and reproductive health and health equity. So I work across a wide range of settings in my research and doing this community-based work. So it includes hospitals, clinics, schools, after-school programs, home visiting programs, so forth. So I think because of both the content of my work as well as the context in which I do my work, I've been able to do make a lot of contributions to policy and advocacy at the local, state, and national levels. So in terms of my professional organization, the primary one I work with is the Society for Adolescent Health and Medicine, or we call it SAM. And in my work to advance evidence-based health policy. So in that capacity, I served as a 2-term chair and am an ongoing consultant on the Committee for Sexual and Reproductive Health. So in this role, I led a series of policy briefs or position statements on various sexual and reproductive health topics, such as just general recommendations around sexual and reproductive health care for adolescents and young adults, confidentiality, explanation of benefits, over-the-counter access to contraception, sexual consent, gender-based violence. The list kind of goes on and on and on. I'm also a consultant on the SAM's Advocacy Committee, where we kind of do much more rapid response to a wide range, honestly, of assaults on adolescent reproductive rights. So most recently, we authored a joint statement with SAM and NASPAG, which is the North American Society of Pediatric and Adolescent Gynecology, on the leaked draft SCOTUS opinion on abortion. And then I'm also an appointed member of the SAM's publication editorial board, where we oversee and provide support for the development of a wide range of policy and position statements for the organizations that are used a lot to both guide policy, practice, training, and is used in, testimonials and response to media requests for statements and such as well.
So thank you, Kathleen. Very helpful. And I think for our audience, the contrast between some of the work Kathleen's doing that's very rapid response, whereas Beth, your work, I think, is more, longer term, strategic development. And so they're, both are examples of roles that you can play with professional associations. So now I'm going to turn to Dr. Kelly Lee and ask for her to share a little bit about her experience.
Sure, thank you. So my experience in advocacy is kind of it wasn't intentional. I never saw myself as an advocate, and I think it's based a lot of the work that I've been involved with has been primarily due to my area of research and as a practitioner in mental health. So I'm a psychiatric pharmacist by training. I trained at UCSF, so happy to be here with all of you. And so as a practitioner, my area of research has been focused on burnout, depression, and suicide. Especially among healthcare workers and trainees and students. And so a lot of the work currently that I do within professional societies is through the American Association of Psychiatric Pharmacists, where a lot of the work that I've been involved with has been pushing, obviously, the scope of practice for psychiatric pharmacists, where we can improve outcomes of our patients who are marginalized and underserved. As well as improving the welfare of all of our healthcare workers for suicide prevention. So my group has been working on with some national databases to look at the increased rates of suicide among physicians, nurses, and pharmacists. And so a lot of the kind of the advocacy work surrounds, right now focused on kind of harmful policies and procedures within health systems that go against protecting our healthcare workers, and if they have mental health crises or suicidality or mental substance use disorders, making sure that they have appropriate programs that don't jeopardize their licensing. But also I look for local organizations like CHIP, Community Health Improvement Partners, where we also educate pharmacists and other trainees for suicide prevention, and making sure that everyone is equipped to address suicidality, no matter what setting you practice in. And so we're hoping that may result in some legislative changes regarding training requirements for our pharmacists, because that is certainly not currently in our scope. The national organization that I mentioned, AAPP, mostly has been surrounding, again, the lack of payment for services for pharmacists, and so Hill visits and so forth that I've been involved with. And all this is really stemming from a lot of the either my committee work. I'm chair of the Professional Affairs Task Committee within the organization. I've been involved in the organization for over 20 some years, and so I've chaired a lot of different committees and so forth. But as a senior member of the organization, I've been involved in some of the advocacy work, which has been really enlightening for me. It's a new area that I never expected as a researcher to be involved in advocacy, but I feel like it's really important to translate our findings into hopefully legislative changes.
Great. Well, thank you very much, Kelly. And I think that one of the things I just want to call out is you mentioned institutional policies in addition to governmental policies. And I think we always think of policy broadly and know that there's often work that can be done to improve institutional policy. For our audience members, we're going to shift gears, and I've got a set of questions where I'm going to ask one panelist to be the primary responder. We will be taking questions. We have the question and answer forum open. So if you have a question as we go along, please put that question in the question and answer box. And then we're going to stop probably around 12:45, 12:50 or so and take those questions. So please ask away. For this next question, I'm going to go first to Beth Phoenix and ask you, Beth, what do you see as the advantages of working with professional societies to advance health policy? What led you to become active with your professional society on your areas of expertise?
Yeah, I think kind of like Kelly, I sort of wandered into it. I just kind of started going to meetings, and when, things came up that I was interested in volunteering for, I volunteered for, and one thing kind of led to another. I think, one of the advantages is that there are a lot of really smart people that you have access to through professional organizations who have a wide variety of different kind of expertise, and who are able to kind of give you a broader perspective on what's going on statewide, nationally, in some cases even internationally. And I think that perspective is very helpful. Certainly, depending on the size of the organization, you have access to resources such as dedicated staff and a website. Through sort of having the opportunity to bring some of these policy issues to the attention of a national organization, you have, the opportunity to have the backing of, people who are outside your immediate scope of influence. And then, most of these organizations that we've been discussing about work in coalition with other groups that are concerned with similar issues. So in the case of the American Psychiatric Nurses Association, there's a mental health advocacy coalition. I don't remember the exact name of it, but it's a broad spectrum of different organizations that are focused on mental health issues, as well as the Nursing Organization Alliance and bigger organizations like the American Nurses Association. And these coalitions may look to your organization for expertise related to your profession or specialty. And, in some organizations, you may have access to lobbyists, but your organization's tax status will determine whether or not that's part of, of your role. And my experience has been APNA is a 5013C, which is not allowed to lobby. So sometimes the leadership has to kind of rein in members or chapters who want the organization to get involved in lobbying, which would, endanger the tax status. But you can always educate policymakers about issues that are relevant to your practice through distribution of policy papers or policy recommendations. And then, as you might be affiliated, like, APNA is affiliated with the American Nurses Association, which is authorized to lobby. So, it's kind of an opportunity to collaborate with them. So those are some kind of key things that I see.
Yeah, I think those are excellent points, Beth. Kathleen Kelly and Beth Griffiths, anything you'd like to add from your experience about advantages of working with professional societies?
No, I think I just reiterate, I think to me, the main advantages have been, the staff and the power of the organization, but also maybe to highlight, I think that this sort of network of other members that you get to really truly often become friends with.
And that's certainly true, and the networking has been my experience as well. Well, Beth Griffiths, while you have the floor, I'd like to flip to the other side of the coin and ask if you've encountered any challenges in working with professional societies on topics in your areas of expertise.
Yes, absolutely. I think certainly people know that probably within the community at UCSF that there are many who see both the positives and oftentimes the negatives to some of the organizations that I've been involved with. And I have certainly experienced that. I have absolutely experienced the advantages, as I just mentioned. A lot of that has had to do with meeting truly tremendous colleagues who are trying to impact policy. I think the way that I have, the challenges I've seen often are that professional societies are sometimes guided by the evidence and not always. I think that they are ultimately what I would describe as very small d democratic organizations for the most part. And so they are really responsive to their members. And particularly with the medical societies, I think historically, they have been more conservative. And so oftentimes we see over time that the people who get involved and stay involved tend to have a similar bent. And so I actually think the challenges become more as perhaps people who are more guided by evidence-based policy choose not to be involved in these organizations. I do think that in the decade-ish, a little longer that I've been involved, I have seen that start to change. And I think a lot of that has been due to the involvement of trainees, medical students, residents, et cetera, and to sort of generational change. So I do think there has absolutely been change. I have always viewed my advocacy as two-pronged. First of all, advocacy within the organization. And, as I said, they're very small d democratic. And so you can go and offer a new policy that you think or a change in policy that should happen. And then when it aligns advocacy outside of the organization for governmental policy change. So it has certainly had challenges, absolutely. I will say my own specialty Society for General Internal Medicine is often much more aligned with me. And so I do find it in some sense easier, but they are quite honestly not very involved in state-based policy, which is where a lot of my expertise and interest is. And so I think that's been a challenge. I will say that I think having a cohort of people that you really consider friends and are honored to do the work with has helped me to feel like that it's much easier to keep going even when there are challenges. You're on mute, Janet.
Thanks. So Kathleen, Kelly, Beth Phoenix, any thoughts?
Yeah, I think Beth covered a lot there. I think I just want to add one of the challenges in working with professional organizations is we're usually all volunteers. There may be a small core staff within the organization, but coordinating schedules and trying to get things through and written together and working together as a group and it can take a long time. And I think just being really mindful of that and trying to be strategic about, what issues you can funnel through the organization because of the review and the board of directors and all of those different layers versus what you can do maybe as a more independent agent as well. So just kind of keeping that sort of dynamic in mind.
Okay.
Yeah, I would really agree with Beth that the whole issue of how representative the leadership of the organization is kind of a big issue because my experience has been that leadership is often dominated by older, whiter, and more established individuals who who may be kind of preoccupied with protecting their own interests. And I think and may not be so well informed or about kind of what are the issues for people who are entering the field. So I think that that's something that kind of always has to be, always have to be very conscious about and encourage diversity in the leadership.
Totally agree. As a so often the minority, I don't feel like a minority in California, but anywhere outside of California, I am the minority. And so I often have to speak up for representativeness, I guess, of all the members. And I just want to add to some of the challenges that I face is that priorities can change depending upon leadership. The leadership changes every year of every organization. And so depending upon, sometimes I'm like, oh, I really like this organization, where they're going. And then all of a sudden in 12 months, you're like, oh, it's completely changed. Like I no longer agree with that. So I think that is a challenge, along with the whole volunteer. I mean, I don't know how many hundreds and thousands of hours I've volunteered in organizations. And when you're a member of like 3, 4, 5 organizations, it becomes a lot. And so, and trying to balance all my other activities as administration and so forth. So becomes quite a challenge. But I think, yeah, well, I can talk more about that later. But yeah, I think those
good.
are some of the challenges.
Yes, Kelly, you've teed up the next question very nicely. So you mentioned being involved in maybe 3 to 5 professional societies. And so, you don't have, there's no way you could possibly devote equal effort to all of them. So,
Yeah.
You mentioned maybe one criteria would be which direction is the leadership headed and how well that aligns. But are there other criteria you use in thinking about how much of my limited time am I going to devote to working with this professional society versus another one?
Yeah, no, I think the American Association of Psychiatric Pharmacists is one that I've maintained since I was a fellow. I went to the first meeting when I was a fellow because my fellowship director said, "Oh, you should really go to this meeting." I'm like, "Okay." So I had no idea, and at the time, the organization was so small that I was literally one of 2 trainees that were there at the meeting, and everyone else was like been in practice for 30 years. So I felt very fish out of water, very uncomfortable. But I forced myself to keep going because I believed in the mission. I believed those are my people. Those are the people that I are in practice with me, and I knew that they would serve as good mentors. And over the time, and as my faculty role has grown, obviously I've become involved with American Association of Colleges of Pharmacy, which is our home. And I think you have to pick organizations that where sometimes your friends are. And all your friends are there, so you go, and it's a great kind of a networking experience and networking opportunity. But I think the core mission of the organization has to align with you. There's some organizations that I chose not to join because I didn't believe in some of their policies and where their direction in which they're going. So I think you have to find 1 or 2 homes, major homes, and see where, how, because I think as faculty, we have lots of priorities and lots of competing interests, and we only have 24 hours in a day. So you have to be strategic about how you spend your time. And you can't spread yourself so thin that you don't do anything correctly. And so you got to pick 1 or 2 things. Maybe as a junior faculty, you pick 1 organization and really, if you really truly believe in their mission, then eventually you will become more involved and maybe you really like where they're going with their advocacy efforts, and that's where you want to spend the time. And as you develop, and I feel like good organizations, the more time you put in, the more you get out of it, and I truly believe that. I've gotten so much benefit out of being involved in some of these organizations that I would never have gotten through my just faculty role. I think that's how I've prioritized my organization involvement. And then in local organizations, I think, that's a different thing because I'm there to serve because I'm also faculty, I'm a practitioner. So I try to serve the local as part of my community service. So that's more me giving back. I may give a talk to the Bipolar Support Alliance group just because that's my role as an educator and NAMI and so forth. But so that's I think it's somewhat different in that you're looking less for what you're trying to get out of that, but you're trying to more do service because of who you are.
Those are great thoughts, and I think that's also important in thinking about when your work is really service. You're more focused on serving others as opposed to advancing, the particular policy research agenda. Great points. So I want to turn it over to others about, sort of your experience in picking and choosing which professional societies you're going to work with.
Well, I would just second what Kelly says about going where your friends are, because, I think that, my experience has certainly been that professional societies have been a great opportunity to kind of find my tribe, to find people who are passionate about the same things that I am passionate about. And, I think that often provides a lot of nurturance and support as you go through the, ups and downs of your career, and various policy initiatives that you may be supporting. So, I think that doesn't get talked about enough, but I think it's really important.
Thanks.
Yeah,
Beth
I
Griffiths, go
agree
ahead.
with both of those things. Definitely, and as I said before, also kind of the level of, is it national, is it state, is it local, where you want to have a policy impact. So definitely, I think that, values alignment and finding your friends are incredibly important. And I find that I often am balancing that also with whether the organization has the ability to really impact policy change, if that is one of your goals. And so in my mind, sometimes there are trade-offs there, and I have basically constantly been a pendulum back and forth, in sort of how different organizations are in a particular moment, my thoughts about what ability I think they have to impact policy change, and also my ability to feel values align and to create internal change within the organization.
Great. Thanks, Beth. Kathleen, anything to add on this point?
I think they have covered it exceptionally well.
Okay. So I would just mention, Beth Griffiths, those trade-offs is I think we do see that there are larger professional societies, be they the American Medical Association, the American Nurses Association, that, are very big organizations, professionalized, have at least one arm of the organization that is legally allowed to lobby. And so I think those organizations have a lot of strength. On the other hand, their agendas are broad, may not be aligned with our particular agendas as faculty members, or even if they are aligned, it just may not be priority number one for them. So I think that is a really important trade-off. There's a lot, tremendous value to being in a more specialized organization that is your tribe, as your friends and colleagues. And that's important, but also the trade-off is that many of our specialized society organizations are small, and as you've alluded to, Kathleen, volunteer, a lot of volunteer led, and that limits impact. And I don't think there's a right or wrong. It's just being aware of those trade-offs.
I agree. And it may, as was already said, it may change from year to year as
Exactly.
well. So I think that, over the last 10 years, it's been a constant for me, sort of dialing up and down, and, maybe spending a little more time in my specialty society or a little more time at a larger organization, depending on where I see it in that particular moment and my bandwidth overall.
Great, great. Well, I want to remind our audience to put your questions in the Q&A forum. Kathleen, next question for you. What advice would you give a junior faculty member or trainee who is looking to engage with professional societies to advance health policy? I mean, would you do what Kelly's mentor did and say, hey, go to this meeting?
I think that's just such a great question. I want to echo something that Kelly had mentioned earlier and really emphasize being strategic. Your time is your most precious resource, and we all have passion for change. That's why we're here. That's why we do the work that we do. And it's an important driver for going above and beyond to advance policy or to do that service part. But as much as we're tempted, we just can't do it all. So thinking about being strategic and looking for those 2 FERs or those 3 FERs or even those 4 FERs, where you can, leverage your research to identify smaller sub-studies that, or offshoots that can involve mentoring trainees or working with other trainees if you're more junior, to get to build up your first author army of publications that are used for your advancement criteria. And when you leverage and work with a team, you end up getting a lot more out of it than you could just as any one individual member alone. So having that opportunity as junior faculty to kind of look at different research agendas, different teams within your department, your division, elsewhere, to see how you can fit and leverage and really become your own independent investigator, and using these opportunities. Most of our research and our work intersects with policy, and so thinking strategically about how you think about the relationship between research and policy, and taking opportunities to write that in your conclusion sections of your manuscripts and set the stage for a particular policy brief or a policy position paper that can leverage both the research that you've done as well as the future directions, and perhaps addressing some of the tremendous barriers that are contributing to, ongoing and pervasive health inequities. I think, also think about policy work that can result in those publications, but also support your role as an emerging leader in the field, right? So, um, you know, I think one of the things that we did with that in that space is that thinking about not just a policy brief that's going to stand on its own as published through organization, but some journals will publish letters to the editors or specific links or specific position statements. So in the case of our response to the SCOTUS leak, we were able to publish that piece in the Journal of Pediatric and Adolescent Gynecology because it was such an important hot topic. So thinking about those synergistic opportunities. I also think that there's opportunities at the local and state levels for getting engaged in policies and programs. I've done that with work related to my research. So I do a lot of work with various state departments, and that work not only aims to promote policies and programs at the statewide level, but it leads to new collaborations, state-funded contracts that provide salary support for specific projects, and again, additional opportunities for publications. And then I think also, especially for junior faculty, get support from mentors, because that mentorship is so key. I am so indebted to Dr. Claire Brindis, who really shaped my original work and thinking around policy around the Affordable Care Act. And her mentorship was so key as we wrote about implications of the act specifically on adolescents and young adults and confidentiality breaches. And we conducted a national scan to identify policies and practices that could address some of those upstream drivers of the social drivers of health. And again, those contracts provide salary support. They lead to next steps. They lead to policy related research and publications that can all be used in your advancement package, which I think it's important to be mindful of those criteria of what we need to meet to move along in the system and to be productive. And then, as we've been talking about, really engaging with with your professional organizations, because most of them do have a policy arm, and that policy and service piece is a really nice synergistic piece that you can leverage for your role at UCSF and elsewhere. I don't know if folks have other things that they'd like to add. I could go on and on.
No, I totally agree. I've been involved in a variety of, you can do research within professional organizations. I've helped the organizations do lots of different projects and get, first author publications through them. Professional organizations, I think for us anyway, at UC San Diego, professional organization involvement goes under professional competence. And establishing yourself as an expert. And it's really hard to establish yourself as an expert if you don't have a lot of publications. But sometimes these professional organizations and the role that you play can support that, right? Because you may be assigned to a chair or a committee member and so forth. And, and that I think you can make an argument that you're selected because of your expertise in a certain area. or some other role that you've had. And I think that that all goes towards your package, or at least it should. So I think there's ways that you can get, and I love that. I always say everything has to count 3 times, in my life. And so, I mean, I think, the professional membership, as well as the advocacy, as well as, some potential publications or white papers or all those things can help with your dossier. So you gotta maximize everything that you do. So I love that.
And I think building on that, Kelly, thinking about what your bandwidth is to take on, what leadership role you have or what you can play, and thinking about, okay, so if you do have that bandwidth, how do you respectfully negotiate what sort of role you want to play in terms of taking that first leadership position on a paper, or if it's really a joint effort, are you going to agree to just present yourselves as in alphabetical order? Like, these things do matter, and if it is that case, it's okay to put a little narrative on your CV to explain the contribution that you did in this collaborative relationship. So I think being mindful of that and being really upfront is something I wish I would have done more as a junior faculty, instead of sort of relying on others to look out for my best interests.
Beth and Beth, any additional thoughts?
I think they've covered it really well. It seems like we are sort of merging into how to use this to sort of burnish your
Right.
CV.
Mhm.
So I don't know, should I just go ahead and
Yes, go ahead.
share
'Cause
my
I think
thoughts with that?
Share thoughts, because I think that is, because we're here at UCSF, and while we very much want folks, to engage in policy work, reality is we all also want to advance within our careers, and part of the name of the game is getting credit and recognition on your CV and elsewhere for the work that you're doing.
Yeah, and I think some of the things that have been mentioned, publications, sort of opportunities to make connections with people that then lead to funding, I think those are important. I also think that the connections you make in professional societies can be very useful, because certainly in my case, whenever I've gone up for promotion, several of my external referees came from people who I knew from being involved in professional associations, which I think, helps speak to your national and international impact, which is important, as you kind of advance. And I think one other thing is that your work in these kind of state, national, international contexts, gets noticed by other people, and sometimes it leads to awards. And a national award is, that's one of the criteria for acceleration. So, I think a lot of those things can be rewards, in addition to just virtue being its own reward.
Yeah, I would agree with so much of what's already been said. I think that maybe one thing I can add is I initially was on the sort of HS clinical pathway and now clinic pathway. And so I think that it is obviously a different pathway than if people are on more of a research focused track. But I would say that my impression has always been that this work is seen as very valuable as sort of the X component, or the other component besides the clinical component, for people who may be in those pathways. And so I've seen it as very positive in that sense. I think also, as everyone mentioned, of course, the external referees, you'll continue to build your network. You may end up, I think I have one time ended up sort of with a funding opportunity that came through, having met people at my professional society. I will say that I think that is more likely to happen at a specialty society, and maybe that's a point for why you might choose to go down that pathway, in my experience, compared to a broader umbrella organization in my own experience. But I have certainly seen that I believe it has been helpful in terms of the promotion, although that hasn't been the primary reason I've done it.
Great. Well, thank you very much. Well, we're now at about 12:45, and I want to reiterate to our audience that if any of you have questions, please put them in the Q&A forum, and they can be questions directed to a specific presenter or to all of us. Well, while we're waiting, I guess I would throw out one question to all of us, and just any thoughts you have on how your policy work with professional societies or other policy work could be better incentivized by University of California. We posed this question, Beth, to a panel in January, but I think it remains an important question, and I'm curious to get additional perspectives.
I think it's a tough question because to me, the barrier is not so much that I don't feel it's incentivized in promotions. It's, as everyone has said, that there is no funding for time to do this work. And so I don't know that necessarily that UC is going to get into the business of funding people's time to do this, but I do think that professional societies should really think about what their model is. And I think I've brought this up a number of times in different contexts, but that essentially they are paying for staff and they're relying on their clinician members to volunteer their time, maybe unless you're like the president of the AMA or some very, very large role. And I think that is a model that is challenging, and that I have certainly seen in particular that people who are in their sort of newer to mid-career phase, I think that's one of the challenges to having more diverse leadership in a number of different factors is the reliance on that, as well as the fact that so often the meeting times are in the evenings, like dinner time hours, particularly challenging for people with young kids.
Yeah, really, really important points, Beth.
I think,
Kelly?
yeah, we're just talking about this in our own department as well regarding workload and, how much professional society involvement, whether it should be, how much of that should be counted toward your workload assessment, right? Some people love, being involved in professional organizations, but at what cost, right? We still have things to do in the school. We still have people to teach. We still have clinical practice. We still have research to do. And I feel like sometimes everything goes toward research. I'm in clinics as well. And so, seems like all they care about is publications, right? I mean, they do care about other things, but just there's a lot of emphasis on publications and it's a numbers game. So I think I wish if I had a magic wand that, I wish that the service component was more delineated to service to professional societies and not just services just dumped into the whole bucket, because oftentimes they always talk about university service, but they don't talk about professional. And if we didn't have anyone being involved in professional societies, then our professions would die. So, and there's no one to be, it's like, imagine that world, right? And so as we're nurturing our students to be professionals, and we always encourage them to be involved in professional societies, well, why wouldn't we reward faculty for being involved in professional societies who are modeling for our trainees? So I've always wondered about that, but I don't have a good solution, and I don't serve on CAP, so.
Well, I think Beth and Kelly are spot on. And I think I would just add a couple of things. One is that, UCSF for accelerated promotions, one of the criteria is service for, I think, 3 years on one of the key committees for the university. And as you were saying, Kelly, could that criteria be expanded a little bit for, significant service in other areas that really make significant contributions and, have some more flexibility in terms of that particular criteria, because service is so impactful on so many levels. Much of what we do for our professional organizations does benefit our university and does benefit our trainees. So I think that's one point. And then I think the other point too is the dollar piece of it. And I've heard of one department, I won't say their name, but they're recapturing some of the indirect rates and providing some core support for faculty to engage in all of the unfunded work that we do. And I think even a little bit of percent FTE to cover that, while it may not be feasible for all departments, and I know this is not a very popular thing for me to say, I think it could go a long way, especially for early faculty who are really facing a lot of demands. They may be starting young families, as you mentioned, Beth. They're trying to establish their careers. They're, really burning the candle at both ends. And Kelly, you study burnout of faculty, and I think we really have to be mindful of how much we add on instead of, really providing that kind of support for faculty and trainees.
And I think it gets perpetuated by those, as you talked about, the leadership makeup of organizations, who are not there, right? It's the moms, it's the, people who are taking care of elders, as well as, every marginalized group, right? That there's a reason why you don't see that, because they're not available. We're being torn at both ends. And I think that's is something that I think pervades, every professional society, every discipline, and so I think that's something that we have to do better at, about rewarding people who are doing this work. And there's not been a focus on that yet.
And I have seen changes across various departments in our own institution where they've been trying to provide awards or support for trainees and junior faculty to attend conferences if they don't necessarily have the funding to attend on their own. And I think even anything we can do in that space while we're trying to tackle some of these bigger issues are important, and we need to continue to pursue those strategies.
Thanks, Kathy. I mean, I think certainly that's important at the, department division level, but I also think, for those of us that are a little more established, to the degree that we have discretionary funds, and we can use some of those funds to send our mentees or help our mentees go to conferences, do policy relevant work. I think that's something, at least for all of us to think of. I mean, it's small contribution, but all of these small contributions can add up as we work on the bigger issues. I am looking at the Q&A and not seeing any questions. So I will, though, point out to those of you that are with us that there is in the this is in the Q&A. And now I'm not sure the best way to do this, Amy, but we do have a link to a post-webinar survey. And so for those who are attending, we really would like you to fill that out. We value your feedback very much. I will just ask our panelists whether any of you have any parting thoughts. If not, we'll end a little early.
I had just one thing I was going to add, which is I have seen some professional societies in the realm of solutions really having childcare on site at conferences, and even giving scholarships for people to be able to bring elders or children that they're caring for to the conferences. I have seen one of the challenges is that a lot of things, as they have moved on Zoom, sometimes then there's the assumption that the same resources are not needed. And I think that has been very, very challenging. So that was just one thing I was gonna add on.
Great point. Yes, just because you're at home doesn't mean you can focus 100%, especially if you have a screaming toddler or an elder who needs transport to an appointment. Right. Other thoughts? Well, if not, I very much want to thank Kathleen, Kelly, Beth, and Beth. Really appreciate your time today and your insights in how we can all work with professional societies to advance health policy.
Thank you so much.
Yeah, thanks for this opportunity.
Bye-bye.
Thank you. Bye-bye.
Bye.